Hello and welcome. Patients at the Manapo hospital in QwaQwa remain helpless. The total shutdown in the area has affected healthcare services. Nurses are also complaining about working long hours with no relief. Earlier, several shops were looted as protests turned violent. School children have also joined their elders in venting their anger. The situation was worsened by the tragic death of an 8-year-old Mosa Mbele who drowned while fetching water from a river. Balekile Mzangwa has been bringing us up to speed on this development. Balekile, what is the latest?
Desiree, we are still at Manapo Hospital. Developments here, we understand that the pharmacy is closed and also the lab has been closed down. Patients are not receiving medication as they supposed to. But with me, I'm joined by the CEO of Manapo, Dr. Mzangwa. Thank you so much for your time. Let's just share the situation here. We've seen patients going to fetch water outside.
No, thank you very much. Let me also actually just appreciate for the professional nurses and doctors that has ventured to come through here despite the very challenging times. We really convey our greatest appreciation. At least now they are living by their oaths. The issue of water, I think, is one of the challenges that we have around here, despite minimum services that have been provided by the municipality. As we are sitting here in third floor, we cannot get water. Go and fetch water from the Jojos. That's what actually the predicament that we are seated with around here.
Let's talk about the lab and the pharmacy. There's no medication now given to patients.
The problem, actually, the shutdown has created many of the challenges to us. Some of our colleagues could not even come, actually, despite that they wanted to come, the roads were closed. The pharmacist was on his way here, he wanted to come, but I said, you are not going to go through the roadblocks that were around there, Anthony. So it's only today that actually I've managed to get hold of him. At least he can maneuver through this road so that we can open them to the pharmacy so that our patients can get there medication as required by Constitution. Also, the issue of the laboratory, the National Health Services is not on because of the challenges of people that haven't turned on for work. And so actually also become a predicament for doctors, for nurses, whatever investigation that you need to do, you don't do them fully. Ultimately, you've got to some of the patients that haven't to be referring to Bethlehem, even if there's no need to refer them, because you cannot get those results.
We managed to talk to patients who are saying that they're supposed to go to Bloemfontein, but due to the shutdown, they are unable to move. Others are being returned home, Doctor.
That's a very pathetic situation, really, to me, that this shutdown, the effects that actually are dribbling around are very of dire need. Of course, patients cannot go to appointments in Bloemfontein. Some patients cannot even access us. And also some patients, ambulances, they cannot even come around. If you happen to have come, really, you must have maneuvered you through the roads. The situation is really, really dire.
And the stretching of the staff that is already here, they did mention to us that now they have to work long hours because others, of course, can make it to the hospital, Doctor.
That's very correct. Once more, for those that actually have dedicated their lives for their patients, those who came the previous night, they could not go home. And they said rather than go home and just work wherever that I hear and then do whatever is supposed to be done. That's really correct what has happened. But I salute them.
And again, food is the problem. They are saying they are hungry.
Yes, food is there. We managed to share with them the food of patients. Fortunately, people in kitchen, they've really risked their life to come and cook for the very same people that are around here. Yesterday, we managed just to share a bit whatever that we have, despite being patient food. We had to give them whatever that we have. But really, we really appreciate.
Just one last question, Doctor. We know that a hospital is a place that should always be hygiene. Toilets are not working. The struggle here is just a situation where we would find out it's not really clean now.
We are soldiering on. People that are around, they have tried their all-level best to whatever little they have, they must cope with it. Into water, there's actually the importance that water is essential. You only realize it when you don't have it.
We've all heard from Dr. Mzangwa. He is the CEO of this hospital, saying that he's happy to see some staffs already, of course, soldiering on, like he is explaining the situation here of water. They also saying that it is a struggle, of course, but they're trying by all means with what they have to assist the patients who are already here, even though now he has also mentioned that the pharmacist didn't make it to the hospital. That's why the pharmacy remains closed. There's no medication for patients while some are returning home but still waiting in the hospital because there's no transportation from the community to the hospital as roads remain barricaded. Residents are still on the street vowing to say enough is enough. What they want is water and won't stop with their demonstration until their demands are met.
A developing story there thanks to our colleague Aphumelele Mdlalane.